Absolutely. I think kind of going off what Dr. Brody just shared about what a powerful component of resilience includes, which is that centrality of relationships. And as Dr. McFadden just shared, that every child needs those sort of safe, stable, nurturing relationships to thrive and to be resilient in the face of adversity. Trauma-informed care is actually a framework that is centered around that very idea of the healing power of a healthy and nurturing relationship. And so I think of trauma-informed care as not a checklist of things to do, but more of a framework, a lens by which we can be anchored to an empathetic or understanding or patient perspective. And so, Dr. McFadden and I talk about this all the time, but that key paradigm shift of what is trauma-informed care. So it starts with we understand what trauma is, we understand what kind of health outcomes they're associated with, and there's a multitude of health outcomes. And then we ask the question, well, if trauma is universal, but at the same time it's disproportionately prevalent among vulnerable communities, historically marginalized and neglected populations, then what should my guardrails be when I interact with not just my patients, but my colleagues, my staff, my family, my friends, right? And so the pivotal question, the paradigm shifting question is, it's not what's wrong with you. When you see behavior in another person that people would describe as problematic or counterproductive or counterintuitive or self-destructive, that we stop the knee-jerk impulse to say what's wrong with you, but we pause, we remember the association between trauma and health and these negative health outcomes, and we ask instead, really what's happened. And I think that mental pivot helps us to get away from, or making sure that we're not just looking at people as a set of diseases or problem lists, or they're defined by their medication, but really remembering that they're a person. It's sort of a way for me that I honor the humanity of every patient and family member that I work with. And so it's not an end all be all, but I think it's a starting place. And as it pertains to the conversation around bias, I think it's one safeguard that we have to be, called that we're trained in, because right now this kind of training does not exist systematically in our health professional educational programs. And so the idea that people in healthcare, health professionals can make it all the way through their training and not understand and learn about this link between trauma and health and the ways that it shows up in so many different chronic diseases and disease and disability and early death, to me is a problem that we have to actively partner together to address.